Due to the pandemic, the federal government declared a public health emergency, which created an urgency for healthcare coverage.
One of the biggest demands we had coming into this project was more speed and reliability of our application. We wanted to get rid of having these planned windows of downtime to update systems. If Washington's Health Benefit Exchange didn't modernize their application, we would have failed the citizens of Washington State and made it much more difficult for them to get the health insurance that they need. The Washington Health Benefit Exchange provides a health insurance marketplace brought on by the Affordable Care Act.
Washington Health Benefit Exchange website was running completely on-premise in a data center within the Midwest in a remote location. It was difficult for us to get to and to manage some of our resources.
The vision we had for this implementation was to increase uptime, increase reliability, and increase performance for our customers. It needs to be solid and in place for them so they can trust that we have a system that they can operate on. The collaboration with Deloitte has been incredibly helpful. They have a lot of experience in a lot of different areas, and we've been able to leverage that to build a better platform for our customers. We chose Red Hat Freescale API based on the OpenShift container platform because it met all of our requirements. We were able to move all of our APIs to it without any problems.
OpenShift has been such a transformational change for us. We now have made changes a few years ago were unimaginable.
With OpenShift and Red Hat platforms, that containerization is brought back so much more reliability. You can easily take things down offline and move it to a different node, and customers don't even notice.
It has helped us collaborate and share the workload across many different areas of our business.
We started with product procurement on day one, and we're able to migrate all of the interfaces, 75 of them, into production in 100 days with no issues and 20% performance improvement. That's the impact that we all have been able to make here in the state of Washington. The Health Benefit Exchange, Red Hat, and Deloitte have collaborated to make sure that there was no gap in delivering something that was a vision a few months ago to being so successful that we have 6% more enrollees come in this year than last year.
The Washington State Health Benefit Exchange was able to provide easier access to healthcare signups for around 2 million Washington State residents, and that has benefited everybody, and especially in the COVID pandemic era.